Good morning. Welcome to our third town hall on COVID-19. David, Paul, and I want to begin by expressing our appreciation to each of you for the amazing work you're doing. To our frontline providers and responders, thank you for the compassionate and professional care that you're providing every day. To our researchers, thank you for pushing the forefront of knowledge so that we can better understand this virus, diagnose infections more accurately and in a more timely fashion, and ultimately develop more effective treatments for patients infected with the virus. And thank you for being a cohesive community that comes together to respond to this crisis. We know that there are concerns, and a lot of those concerns are driven by the uncertainty that surrounds the infection itself, the spread of the infection, and how it affects our community. And a lot of those concerns are in the area of personal protective equipment, PPE. We therefore want to devote this town hall today to a discussion of PPE, how it's being utilized in our Stanford medicine community today, and how decisions are being made and how supplies are being obtained. We've assembled a task force that is here today to answer your questions and provide some more detailed background information on the topic of PPE. But before turning it over to David, I want to again thank you for the amazing work you're doing. You inspire us every day, and we're here to work with you, to serve you, and to be with you during this crisis. David?
Thank you, Lloyd. Welcome, everyone. It's great to have you here with us. As we have said before, we had over 9,000 that joined us last time, so we appreciate the engagement that is here, all those individuals who are involved. And many of you have had many questions that have come in. As Lloyd shared, one of the preeminent questions last time is, do we have the right materials? Do we have the PPE to protect our staff that are providing the care? And so it was important for us today to talk about this as one of those premier questions that you have. So as Lloyd shared, we've got the task force that's been working on this today with us that can talk real time about some of the things that we're doing. I will share, though, that there have been a tremendous amount of resources that have been throughout our community that are actually making sure that we can secure the necessary equipment that you need. I can say everywhere from the president of the university, from our individual board members, both across Packard and across the adult hospital, as we look at our elected officials. We in fact had calls yesterday with Hannah Eshu and Jackie Spear, who were also on the front line making sure that we get the equipment that we need. I can tell you that since Sunday, we have literally had shipments every day of equipment and resources that are coming in to make sure that we have the right pieces. We are sourcing from outside of the country, inside of the country, et cetera. And so I know that there's a lot of information that's going around that you will see in the public that's very prominent on the news about individuals and other healthcare facilities that are very real time, don't have the materials that they need. And that's something that we don't want to get ourselves in a position here, and is something that's very important to us. And there's a lot of individuals focused on doing that. But you're on the front lines. You're the ones that are interacting with our patients, and we want to make sure our top priority is to make sure that you're protected, that you have the resources that you need. We know there's a lot of individuals that are sequestered at home, but you're here every day. These are unprecedented times. And what we're seeing on an unprecedented basis across our organization, but also across the world. And we want to make sure that you know that our priority is to get you the equipment that you need, that you're safe, so that we can do the things necessary to care for the community we have. Thank you doesn't seem significant enough right now, but I want to say thank you for the great work that you're doing. And we want to be able to be transparent with the information that we're sharing and share more with you today. Thanks for you for joining us. Let me now turn a few minutes over to Paul.
Thank you, David and Lloyd. I'd like to echo their comments around gratitude and pride of working on this Stanford team. As an academic medical center, we embrace curiosity, innovation, and discovery. This is a truly historic public health crisis we're facing right now. We are in uncharted territory. At Stanford, we're leaning in. We want to be part of the solution. We are very proud that we've developed new tests. Our researchers are actively engaged in developing treatments and cures for this crisis. Today, as my colleagues have already stated, we're going to be focusing on PPE. The supply chain is a challenge. The entire world is seeking the same equipment that we need to care for our patients as well. We hear your concerns. We know that you're afraid for yourself, for your coworkers, and for your families. We are leaving no stone unturned to make sure that you have the equipment that you need to provide care to our patients. We're committed to keeping you safe so that you can be here for others doing what you do best. Thank you again for tuning into this morning. I'm going to turn the town hall over to Mary Hahn. She's chair of our Department of Surgery, and you'll hear from her and 5 members of our PPE Task Force. Mary.
Great. Thank you, Paul. In response to the COVID-19 pandemic, Stanford Medicine has assembled a PPE task force. Our charge is to constantly assess, develop, and update our PPE guidelines and recommendations for our healthcare workers. We need to balance the risk to the healthcare worker and ensure that we have adequate supply of PPE to the healthcare workers that are in the highest risk for exposure. I'm glad to be joined by members of our PPE task force this morning to answer your questions that are arising around PPE. So this morning I'm joined by Dr. Denny Lund, who's the Chief Medical Officer of Stanford Children's Hospital, Dr. Bonnie Maldonado, Professor of Epidemiology and Infectious Diseases, Dr. Norm Risk, is the Chief Medical Officer for Stanford Healthcare, Dr. Sam Wald, who's the Vice President over Perioperative Services, and Amanda Chawla, who's the Vice President for our supply chain. We had several questions submitted in advance, so let's jump in and tackle those first, and then we'll get to the live questions. Our first question I'm going to direct toward Dr. Norm Risk and Dr. Denny Lund. If there is a shortage, how will PPE be triaged to staff? How will you keep employees safe? Norm, why don't we start with you?
Okay, thanks. Well, I want to say first that we're very fortunate to have expert infection control officers in Bonnie Maldonado and Lucy Tompkins and Marissa Halubar, who are reviewing all of the scientific evidence as it emerges, and we have behind them the foundational guidelines of the Centers for Disease Control. Those two inputs allow us to be intelligent about how we use our protective gear and are part and parcel of how the guidelines are developed. We're also monitoring the supply and the demand and usage of the protective gear every day, and the information is fed daily to the PPE Task Force. Now, I know that currently we're actually using more PPE gear than is recommended, and that's probably due to the natural fear all of us have of this disease. But I have to say that just like hope isn't a plan, fear is not a plan, and it needs to be evidence-based. And so we're very fortunate to be able to have a group of people that are assessing and shifting through that evidence every day. In the end, we'll all be best served by adhering to the guidelines so that we don't mortgage our future and run out of PPE later. And I think at this time, we're not in a position that we need to worry about that. And we will have adequate gear for everyone as long as we adhere to the guidelines, which are being continuously reevaluated by the group. So we're in a fortunate position. We just have to make sure that we stay there.
Denny, how about Stanford Children's Hospital? How are you approaching this?
So thank you, Mary. The Stanford Children's Hospital is working very hard to be in absolute lockstep with Stanford Healthcare and the rest of the Stanford medicine ecosystem. We've been very fortunate in pediatrics that we're not seeing a lot of COVID-19 disease, but we are part of the team, and we want to follow the guidelines that are prescribed by our PPE team. We're having input, we're participating, and we have a very much of a seat at the table. I do want to emphasize, as Norm said, is that we have chosen as a minimum to meet CDC requirements for PPE use, and our PPE team has actually developed a very nice set of guidelines that are actually quite a bit in excess of CDC guidelines. We're going to continue through our various mechanisms here at Stanford Healthcare to reassess that on a daily basis, period. In fact, it's nice that we haven't seen a surge here, but we have to prepare for that, and so we're doing all kinds of planning, both around PPE and manpower, and Packard is very much involved in that.
Thank you. Amanda, next question is for you. What is our current supply of PPE? What are the chances that we will run out as the need increases? And what are we doing to obtain more?
Thank you, Mary. This is such a vital question. And as we know, the market and situation is very fluid and dynamic. Our supplies from a nationwide perspective and a global perspective is in a shortage, while demand continues to increase. I'd like to take a minute to show you a visual of what we have done. On the supply side, I am proud to share with you how our supply chain and Stanford medicine community as a whole has come together to increase the funnel with new channels of sourcing, from donations to emergency resources. While supplies are still coming in, our demand is exceeding. And we must prepare for a surge. And in order to prepare for a surge, we have to conserve some of our supplies. And that means appropriate utilization. It is vitally important that we are in this together, as this is a very fluid situation with limited supply and an increasing demand. So it's the work that we do together. Thank you.
Great. I'll take the next question. Can you communicate regularly to the staff regarding our supply of PPE? So yes, I think it's incumbent on all of us as leaders to really discuss the importance of our PPE supply, how we need to conserve it, how we need to use it, and how we identify what is the high-risk exposure and what is a low-risk exposure. So I'm on the front line with you, my faculty on the front line, taking care of patients, seeing consults in the emergency room, in the operating room, rounding on the wards, and we are constantly having that discussion. Is this an appropriate place to use PPE? And what, if we do choose to use PPE or use PPE, what PPE should we use? And this town hall is another great example of how we're trying to get the message out to everybody of what we are doing to ensure that you will have the adequate PPE to protect yourself. Sam, next question for you. Do I need PPE for any patient encounter if the patient is asymptomatic?
So I'd like to again express our thanks and my personal thanks for those of you who are on the front lines doing procedures and patient exams. As you see in front of you, you might have two very different types of patients who are asymptomatic but undergoing a high-risk procedure for transmission of the virus or a very low-risk procedure. And why is this important? Because we want to take care of your safety and our patient safety. And part of determining what's a high risk and what's a low risk procedure and appropriate use of PPE saves PPE for you for the future for when you really need it. So you are paying yourself by being very careful about appropriately categorizing when you want to use a lot of PPE and when you don't need to, such as a low risk procedure. Thank you, Mary.
Thank you. Bonnie, next question for you. Should healthcare employees over 65 or those with chronic conditions stay at home?
That's a very good question. Thank you so much. As you all know, we have heard from around the world that the highest risk group for severe complications of COVID-19 are those people with certain underlying conditions, as well as people over 65. And I think for our frontline providers, that's a really important consideration for you to take into account when you're thinking about your specific job description. That is, what are you doing every day to minimize exposure to your patients? What are you doing, for example, by doing more telehealth if that's possible, and as you've heard, canceling elective procedures. But beyond that, if you have personal concerns about yourself, and we want to make sure that we are able to respect your own personal privacy about any healthcare conditions that you might have, so you can bring those confidentially to your senior leadership and ask them in a confidential discussion about what you think yourself about your risk and what your leadership, either whether it's a division chief, a department chair, a unit leader, or a supervisor, in a confidential way, how you can deal with that concern. And if in the end you feel that you need to step back from some activities, that can be worked out into your schedule, or you may choose other options as well.
Thank you, Bonnie. Norm and Sam, what has Stanford done to minimize elective visits and procedures in light of the limited PPE?
Well, to maintain our PPE supply and to assure that we're not part of spreading the disorder, we restricted our patients that we're seeing in the ambulatory setting to those that are just urgent or emergent, that have to be seen on a one-by-one basis. The large majority of our patients are elective, even though we're maintaining their health and preserving their health. And those have been largely transferred to electronic virtual visits, digital visits. We've moved very, very rapidly in that, and the whole faculty has been receiving training in it and additional computers that they can use at home. So really we've moved to take away the elective cases to make room for a potential coming surge and to protect PPE. And I'll let Sam talk about the perioperative services, the procedural areas.
Thank you, Norman. So the reason that this has happened, the reason for the recommendation for the decrease in elective procedures is twofold. One is to conserve PPE so that we have it for the future, and so that we have hospital beds, so that we have ICU beds, and we also have our healthcare workforce. The other reason is to decrease spread in the community and decrease spread among healthcare workers. And in doing so, what we did is we came up with a three-tiered system, a tier of elective cases, which we've all canceled, and urgent cases and emergent cases. And we did this immediately upon learning what the recommendation was from the CDC, and this has resulted in over a 50% case drop in our total cases by canceling all elective cases. Thank you.
Great. So now we will take live questions. Our first question goes to Bonnie and Norm. Why are we not mandating universal masking? Why don't we start with you, Bonnie?
Yes, that's a very good question. I think in general, when we look at principles of infectious diseases and infection control, we want to understand what is the mechanism of transmission of an organism. Since we don't know that right now in absolute certainty, we are using what has happened in China and Italy and other places and experience with other viruses similar to the SARS-CoV-2 virus in order to understand how to protect ourselves. And what we understand very clearly is this is really a droplet spread disease right now. All of the evidence points to that, and we know how to protect people when they are properly using PPE from droplet disease, either from the patient perspective and from the provider perspective. So that is really in keeping what we do all the time. Universal masking will not help prevent disease, especially if you use that as a false sense of security and not practicing proper procedures such as hand washing, gel, etc.
Thank you. Norm, would you like to address this as well, please?
Well, I just want to emphasize that the overwhelming evidence is that it's a droplet disease. Surgical masks on the healthcare worker don't really protect very much against that. It's largely if it's placed on a patient that's ill, and we can evaluate that in terms of their symptoms. So it doesn't offer much protection, and in that setting, we want to conserve the PPE. If it got to a point where it was extremely prevalent in the community and that we were seeing spread in some areas, then we might reconsider that. This is part of the continual reevaluation of the place we're at in terms of the epidemic.
Great. Amanda, what are you hearing about 3D printed PPE? Is that a potentially viable source for us?
Mary, that's an excellent question. In fact, Stanford is leading a 3D PPE task force. We're actively reviewing all types of PPE materials through this task force for 3D printing, and we are very close to being able to release and have a viable product of one of our PPE items. This task force consists of engineers, infectious control colleagues, as well as our IT partners and supply chain.
Norm, how many healthcare workers at Stanford Medicine have tested positive for COVID-19?
Well, if you look at all of the testing we've done across all of our sites, there's about 6,500 tests that we've done, and they have a positivity rate in aggregate of 8.49%, so between 8 and 9%. If you look at our healthcare workers, it's much, much smaller than that. It's run largely around 2%. We had one day that was 5%, but that was greatly an outlier. And when we look at tests sent from the outside, they're much more positive, like 11 or 12%. So our healthcare workers have a low rate of positivity, and we believe that most of that's acquired by community spread.
All right, Amanda, another one for you. I've seen requests for PPE donations, but my unit has been told the masks that we have brought do not meet Stanford's standards. Why are we asking for PPE donations if we are only allowed to use Stanford issue PPE?
Well, in fact, let me just clarify here. We are asking for PPE donations, and we are looking for masks that are safe for our providers for protection. That means masks that are rated for fluid resistance as well as bacterial efficiencies. And so those are some of the quality standards that we are taking a look at when we are bringing the masks in. And we actually have all types of masks that are coming in today.
And that was a really common question for the PPE Task Force. If there are masks out there, why are we not using them? First, we don't know that they are as effective as the masks that we can provide you in the environment that you need it. And so we don't want to create an inequity of not having the proper mask for people when they need it. So we continue to assess this, but we want to make sure that there's equitable distribution of PPE and at the site where it's absolutely needed. Norm, what type of PPE should be worn by clinical support staff in the ambulatory setting for screening patients and visitors for COVID symptoms before entering clinics and buildings?
Well, we've permitted use of surgical masks for people outside the doors that are screening patients and visitors for COVID symptoms before entering the clinic buildings. It's partially a reassurance technique because, again, the CDC does not recommend in the general public wearing masks in public areas, but because it's the portal to the hospital, we're allowing that currently.
And I just wanted to add to that because we recognize people's concerns that they're standing at the portal to our hospitals and that they may be the front-facing people to all comers, and they may not know what the symptoms of the individual patient might be, that even though you wear a mask, that is not what is going to protect you from becoming infected. You really need to keep your hands away from your face, don't touch the mask, and make sure you gel if you touch surfaces.
Okay, Bonnie, next question for you is other institutions have limited employee access to specific entrances and are doing temperature checks before allowing entry. Why aren't we doing the same? If you wouldn't mind clarifying in this question what you consider an exposure from an asymptomatic or a symptomatic patient or person.
Yeah, so so let me just start with that. So an exposure, according to our guidelines here, and of course these will change, they may change over time if we discover more, but these recommendations have been pretty stable. So we really think that an exposure is primarily occurs when we have somebody with symptoms, that is a fever of 100 degrees or greater, shortness of breath, a cough, a sore throat, or other respiratory symptoms. And those exposures are considered low risk if the person has been around or in a room with somebody like that outside of 6 feet of that person or for less than 10 minutes. It's considered moderate risk if they've been closer to that person without proper PPE within 6 feet and for at least 10 minutes or longer. And so those are the moderate risk. Closer than that, that is not wearing PPE or improper PPE with somebody with symptoms where you've been very close to the face is considered high risk. In the situation that you asked right now about our institution, in fact, we are asking that. And in fact, every supervisor knows or should know, and hopefully you'll learn today, that everybody should be making sure that they are monitoring themselves for symptoms and calling into their supervisors if they think that they have evidence of fever or other illnesses. And if they have a fever, they should not be coming into work.
Okay. And similarly on that line, for our physicians, we actually have them email and set up an appointment if they have symptoms and they go to occupational health. And the same thing we're directing any of our frontline staff who have symptoms is to present to occupational health, or if it's after hours, to the emergency room to be screened. Okay, next one is for me. Are you accepting handmade or hand-sewn masks for donation? Why or why not? So we are not accepting handmade or hand-sewn masks for donations. And we're not encouraging people who have like a handmade or a cloth mask to wear them at work for two reasons. One, because they're really not certified or validated to be provide any protection. And second, that mask can get dirty over the day if the mask isn't protected. And if you're reusing it, it could also get exposed. And then you may touch it, just like you might touch your face. So right now, we don't think that that mask provides any benefit and actually may provide some harm to you and to others around you. All right, to all, what is our government doing to increase the nation's supply of PPE and critical equipment like ventilators? Maybe, Amanda, maybe you can start with what the government response has been.
Sure, absolutely. So through our Office of Emergency Management, we have been in constant communication multiple times a day with our state and county and our national government agencies. We have our government relations team that is in contact to ensure that Stanford is well represented and we are receiving our requests and the supplies that we need.
Norm, would you like to make a specific comment on the ventilators?
Sure. So as many of you know, right now we have 83 staffed ICU beds, and we have plans to increase it to about 150 ICU beds. This will require more ventilators. We have a census of ventilators that would allow us to get up to about 100 without difficulty, but we also have anesthesia machines that can be used as mechanical ventilators, transport machines that are similar. And we are looking, though, in the external market for additional ventilators. As I think most of you know, the government is relying on private industry largely to build more ventilators, and the car companies, Tesla and GM, have come forward. But we believe we will have enough ventilators to supply the beds that we can staff, and we're expanding our facilities to make that possible.
Denny, can you comment about Stanford Children's Hospital's ability to respond to the surge?
Yes, thank you, Mary. So at Stanford, we have 72 ICU beds and another 74 neonatal intensive care unit beds. We actually have about a 30% excess of ventilators to staffed beds. So we feel like we've got a pretty good supply of ventilators. Now, of course, they're ventilators that are specialized for use in children, so not all of them would be appropriate for use in an adult, should that come along. But we think we've got plenty of capacity. And as I mentioned earlier, again, we're not seeing a tremendous amount of this disease either here or anywhere across the United States in children.
Okay, this is going to be the last live question. This is going to go to Bonnie. We keep hearing about the surge. What might that look like? Has the Bay Area shown any success in flattening the curve?
Well, as some of you who have heard us talk about this before, There's no way to predict what an epidemic will do over time. It's virus and organism specific, but we have a fabulous group of faculty members here and researchers who are actually taking real-time data from our county and from our hospital and from around the country as well to try to model what is happening in real time and predict at least 2 to 3 weeks ahead. And we think that we are maybe seeing a slight decrease in the prediction of this curve, that is maybe a flattening, but we don't know yet. We're very hopeful that that will happen. More importantly, even if it does happen, we have prepared based on our very nice models for what we predict a surge might look like here at Stanford Medicine. And then finally, we have to be very careful to make sure that all of us participate in these sheltering and home situations so that we can actually help each other to prevent spread of this disease so that we can bend the curve in the end.
So on behalf of the PPE Task Force, we really hear your concerns out there. We are greatly appreciative of everything you're doing on the front line, and we are doing everything we can to ensure you have the proper PPE available to you when you need it. I'd now like to turn it over to Dean Miner for some closing remarks.
Thank you, Mary. We appreciate the work that you and other members of the PPE Task Force are doing. And to everyone in our Stanford Medicine community, we'd like to end this town hall the way we began it, by thanking you for the amazing work you're doing. We hope that this town hall on PPE has answered some of your questions. We welcome your feedback. We want to be able to respond to your questions and give you as much information as we can. We'll be here again next Thursday for another town hall devoted to COVID-19. And thank you. Be well, and we'll see you again next week.